Back, and many thanks for staying with us right here on the #1 breakfast show, Morning at 10 TV. We take pride in the fact that we lose sleep on a weekday basis just to ensure that we acquaint you with the information that you really clamor for, that you really need to conquer your day, conquer your week, vis-a-vis conquer your careers. Well, today being World AIDS Day, Uganda AIDS Commission is saying if they do not get 28.5 trillion Uganda shillings, new infections are going to increase by 2030, and that is around 140,000 new infections that will be registered. I was reading an old article around 2016, and they were contending at the time that if we do not do anything, infections might increase by 2025 to over 300,000 infections, meaning the situation is really, really dire. Dr. Nelson Musoba is going to be acquainting us with all those numbers and so forth. What are the prevalence rates at the moment? We're talking about 7.1 in the urban areas, 5.5 in the rural areas. Why is it like that? We also want to know why the men aged 45 to 49 are seeing a higher prevalence of 14%, and the ladies between 45 and 49 are seeing a lower prevalence rate of only 12%. What is the problem? We're also getting information that the older generation is infecting the teenagers down under 15 to 24. Higher prevalence rates are among that age group, 15 to 24, the young girls. But for the young boys between 15 to 24, the situation is actually very, very different. That's what we want to interrogate right here on Morning at 10 TV with the Director General of the Uganda AIDS Commission, Dr. Nelson Musoba, who joins me right now on set. It's not the first time he's appearing. A very good morning, sir.
Good morning.
Indeed. Always a pleasure interacting with you on this platform.
Thank you for having me.
Because you come with a wealth of information, and at a time when individuals are grappling with lack of sexuality education to, come up with measures as to, dampen the resolve of the HIV infections going ahead and infecting so many people. We are talking about 2021. We shouldn't be talking about 50% of this population not knowing how to use a condom, but the statistics are still stagnant. Just like 2016, 50% of this population does not know how to use a condom, and that is a callous development, isn't it, Dr. Nelson?
Yes, it is. Indeed, thank you for that and for recapping the statistics very accurately.
Indeed.
And what is true from what you've said is that comprehensive knowledge, although we have a lot of awareness, we still have, people who do not have all the knowledge about how HIV is transmitted. And therefore, they're engaging in the risk perception is still very low. And they're engaging in practices that put them at risk of getting new HIV infections. And that includes multiple sexual partners who are not their permanent partners, non-correct use of condoms and inconsistent use, and then, other practices that change, their accuracy to determine, to be able to do the right thing, like alcohol use, drug use. And that all puts our people at risk and gets them predisposed to acquiring new HIV infections. Indeed,
Dr. Nelson Musoba, according to the statistics that you produced in 2019, it indicated that we do have a population of 1.4 million living with HIV. And you also did contend that 1.2 million of those people are actually on medication. Where are the 200,000? And has that number since increased from 1.4? What are we looking at in 2021?
In 2021, so every year we do the numbers. So now we have a report that actually shows us the numbers from 2020.
Indeed.
And because you're having new babies being born, and when we make sure that the babies being born, fewer of them have HIV infection, so that number...
Child to mother.
Child to mother transmission. So we are now talking about an HIV prevalence of 5.4 average. From about 6.2 in 2016, it's 5.4 now, based on data modeling projections. The Ministry of Health is doing a population-based sero survey, and we should have those results out maybe next year. But from our experience, they don't vary much.
What would you say are the contributing factors to the reduction in the prevalence rates from 6 to 5?
We've had a reduction in new HIV infections because in the previous year, in 2019, we had 53,000 new HIV infections. In 2020, we had 38,000. So there's a reduction. Of course, COVID-19 and lockdowns came with lots of negative impacts. But like the English saying goes, for every dark cloud, there is a silver lining. A lot of social activity was restrained. It may be one of the factors that is accounting for that reduction, but also the interventions. Some of the interventions continued. People continue to access HIV testing services, ARTs. There was a decline in utilization, but overall, we see a reduction in new infections. We see a reduction in prevalence. And, but there was a slight rise in AIDS-related deaths.
Indeed.
From 21,000 in 2019 to 22,000.
What contributed to that, Dr. Nelson?
We need to look at the details, but currently somebody shouldn't be dying from AIDS because we have the science, we have the medicine, the tools are available. Now, one of the contributors is when you stay and report late, when you've started getting opportunistic infections,
yes,
or when you start on treatment and drop out for some reason. There are many reasons why people drop out.
Indeed.
It may be financial, but most of it is stigma because people have not come out.
Especially the men.
Yeah, they are not living openly with HIV. And that once they default, they report late, the viral load goes up, and you get life-threatening conditions, and very often that is what kills them. Tuberculosis is the #1 killer of people living with HIV.
Indeed, of course, the COVID-19 pandemic has not made it any easier. Imagine you have HIV, then you get TB,
yes,
and then you get COVID-19. That is a triple threat.
That is
chances
complex,
of survival are slim.
Are slim, and of course we know that COVID affected most those who had comorbidities. We've not, the Minister of Health hasn't given us that data of how many of the people who died of COVID
had TB.
Had TB or had HIV. We've not synthesized that data yet, but it can come out. But we know that if you have HIV and you get COVID, your outcome is likely to be worse than somebody who gets COVID when they do not have any other existing condition.
And of course, let's talk about the prevalence rate, urban areas vis-a-vis rural areas. 7.1% prevalence in the urban areas, Kampala
Yes.
metropolitan and the surrounding environs. Rural areas, 5.5 prevalence rate. Largely, we would know that the urban areas, people there have a lot of information in HIV, but for the rural areas, there's lesser information or lesser, connectivity to the internet to just go on your phone and maybe get some information on how to use a condom, how to, access PEP drugs and so forth to prevent HIV transmission. But then the people who have lesser information are seeing a lower prevalence, and the people who have higher cases of information penetration are seeing a higher prevalence. Why, Dr. Nelson?
Well, the urban areas, there is more than just information. First of all, there's a lot of rural-urban migration.
I see.
The suburban areas have populations that, have issues of income, They are not necessarily, you are in the urban area, but you may not have money to go to the health facility, but also your lifestyle. Your lifestyle may be such that, you're more predisposed to getting HIV. We also have a lot of people moving to seek services in the urban areas, so people coming in, they are coming either to live with relatives, to be able to visit hospitals, get medication. So when you combine all those factors, rural-urban migration, income inequality, and they may be in the urban areas, but they are hustling, they are spending time, they can't look at the information that is available, they don't even get time to, watch TV, read a newspaper, look at a phone. So it's an assumption that being in the urban area means access to information, but that's only for a specific subgroup of the population.
And another problem are the fishing landing sites, Dr.
Yes.
Nelson Musoba. We are talking about a national prevalence of 5%, but for the fishing landing sites, we're talking about 20% prevalence.
Yes.
And it doesn't matter if it is the men or women. It is actually stagnant. For the men, 20%, for the women, 20%. Why? What is precipitating this?
Now, the island areas, the fisher folks, they are young people. They are very dynamic. When you're young, you're feeling invisible, but they also have money in their pockets. And when they get this money, they want to have leisure, and they do not have information. And, so there is a lot of transactional sex, buying, getting sex in exchange for money. And all those factors, of course, multiple concurrent sexual partnerships, sharing, sexual partners. So there is a number of risk factors that predispose the young people around doing fishing activities. And when you're talking about the fisher folks, it's a whole chain of people, the ones who go out in the lake to fish, the people who dry the fish, those who are selling the fish. So that whole chain is interacting, and then it becomes a very good breeding ground for the virus to go up.
And the mobility issue is the fact that they move from one place to another.
Yes, that is the other one, is that they move from one place to another. They are going to, when fish disappears on this side of the country, they are moving to Kenya, they are moving to Tanzania, they are moving to Busoga, Uganda, and it's a very good breeding ground for.
And wherever they
HIV.
go, they are transacting sexual intercourse and spreading the HIV disease.
That's
among
right.
the sex workers, to be exact. We've noticed, like I did mention, 5% prevalence nationally, 20% in the fishing communities, and now 31% among the sex workers.
That's right.
Why are we not actually coming up with campaigns to target these individuals, the sex workers, with a lot of, agility in that regard? But first off, tell us, what are the factors precipitating the rise of HIV infections among the sex workers? Again,
it is, it's a high-risk kind of thing that they're indulging in, because transactional sex, if you're the recipient of the money, it disadvantages you. It kind of removes your power for negotiation.
I see.
When somebody pays you, they say, the English saying again is that the one who pays the piper calls the tune.
I see.
Yeah, so it puts them at a disadvantage.
Indeed.
And they are having multiple partners, they are exposed, sometimes they do not have the time. But there are services. The Ministry of Health has designed services. They are our implementing partners who are specifically going out to serve this group. We have, facilities that open, flexible opening hours, going out with the testing, distributing them with condoms. But still, because of what they are engaged in, because of, who they are engaging with, again, the HIV prevalence is much, much higher than the general population.
This is the callous development, Dr. Nelson Musoba. It is one thing to know that the sex workers have a high prevalence of 31%, and it is another to find out they don't want to actually make their information public. They don't want to go to the health centers to actually declare that they are HIV positive because of cases to do with discrimination, stigmatization. Aren't we sitting on a time bomb whereby people who have this disease are now spreading it because they are fearing reprisal if they go public?
Stigma is really a major issue, and thank you for touching on that. And once we saw that as Uganda AIDS Commission, we worked with the National Forum of People Living with HIV. We've now developed and launched an anti-stigma and discrimination policy. We are distributing it around the country. It is explaining what is stigma, who gets stigmatized, what do you do once you get stigmatized, whom can you approach, what are the roles of government, what are the roles of the other stakeholders. So it's a major problem. 40 years of living with HIV, but stigma remains. It has reduced significantly, but it still remains an issue, even within families, not just even not just among sex workers.
Dr. Nelson Musoba, these people are not coming out anytime soon. Isn't this a danger? They are saying even the criminalization of sex work is actually adding fuel to this fire and causing more problems. It is stopping them from going to the health centers because sex work is criminalized.
It is, but from the public health perspective, the Ministry of Health has designed different interventions. There is very specific training of health workers to ensure that this population subgroup, is when somebody comes with a public health condition, when they are ill, as a health professional, as somebody providing a service, you're not condemning them. You're not looking for how they acquired the condition. You're looking at alleviating the problem. And then, the other side. But we're also working with other stakeholders, like the police, the judiciary, to ensure that they are aware about these issues. And so far, I do not think that they are having issues coming to the health facility, and they would really, they are encouraged. They should go there. They should, the health workers would be ready to receive them, give them information, give them services.
Won't there be reprisal on the part where health workers report these individuals, because sex work is criminalized, and this person, even when they're asked, what job do you do, they cannot even say because it's illegal?
Health workers operate under an ethical code of conduct. We are supposed to observe privacy and confidentiality of the patient. If we reveal, unless we are compelled by the courts of law, we are not supposed to reveal, the condition of an HIV patient to the police, for instance, or any other. But although the courts can compel you to do that, but so far nothing of that incident has happened. So the sex workers should be confident. They should seek help. The health workers will ensure that they get services, they get tested, they are issued with the condoms, they get treatment. Instead of fearing that.
Dr. Nelson Musoba, I was reading the HIV Control and Prevention Act, and it actually allows health workers to divulge this information.
It does.
It doesn't stop them from divulging. It actually tells them, if you are a health worker, you are actually at liberty to divulge this information and make it public. If Romeo Busiku comes and he says it's HIV positive, the law actually allows you to divulge this information. Isn't this a problem and the reason as to why people are not going to these health centers?
There is debate around that clause in the HIV Prevention and Control Law. About criminalization of HIV. It's, there's debate whether it's a good thing for public health, whether it will not make people go underground and lead to spread, or whether it will. But when you look at the practice, the actual practice, and go into a health facility and assess there isn't people being reported to police because they have gone there and they are sex workers and they have HIV.
Dr. Nelson Musaba, according to the 2015 World Health Organization guidelines that were produced in that year, they would actually warrant jurisdictions to actually tell their citizens to get on HIV medication, regardless of their CD4 count.
Yes.
Doesn't matter if it is low or high. If you have HIV, please get on medication. But then we did notice that for the men, they've been actually slow or adamant to get onto their HIV regimen or ARV drugs.
Yes.
What could be the problem? Why are men shying away from taking medication for HIV?
It's how, you know, we are brought up as men, especially the African man, because patriarchy dictates that, you know, the African, you are the leader of the family, you are the breadwinner, you are strong, you shouldn't be seen. So men feel stigmatized going and lining up in the health facilities. And very often, many of them deduct their HIV status from the status of their partners or spouses.
If she's okay, I'm okay.
Yeah, if she's positive, I might be positive, when it's not necessarily the case.
Indeed.
So there again, intervention is particularly targeting the men. We are working with male champions like the King of Buganda, King Oyo of Toro, you know, the religious leaders, to say that a strong man, a champion, is a man who, you know, knows his HIV status,
I hear you.
who protects his spouse, who protects his child, you know, who shares, who goes and knows the status of his health.
Is that the reason why men have been finding it so hard to virally suppress HIV in this country? Because for the women, they can virally suppress HIV up to 80%, but for the men, it's only around 53%.
Yes, men
They've failed. Why? Is it because of that reason?
Yeah, men have
late adherence.
Yeah, poor adherence. They seek health services late, very reluctant. Even when they do, they are not adhering. So they are very easily stigmatized. First of all, we have what is known as internal stigma. The women deal with that much better, and that is why more than 95% of the women who become pregnant are started on ART compared to the men. You know, they are starting treatment late. So out of the 22,000 people who died in 2020, 60% of those were men because of reporting late for treatment.
And for the children, viral suppression is now at 33%. For the women, 80, like I said, the men 53. Now for the children, 33. Why? Is it that they have failed to virally suppress HIV? Is it because we are failing to detect it at the early stages through mother-to-child transmission?
Of course, the children, unfortunately, it means that somebody is failing to do their job, because a child needs to have a carer. And very often, if a child has HIV, it means that if the carer is feeling stigmatized and they will not go out
to the health center,
then they will not take the child, especially for the younger one, because when we are talking about children, we are talking from 0 to 14 years of age. And therefore, we need to target carers and mothers to ensure that they have information on what to do from when they are pregnant, where they deliver from, and what to do post-delivery to ensure that how to breastfeed, and even when they have weaned off these children, what they should do to ensure that those who are negative remain negative, even when the mother is positive, and those who may have seroconverted, you know, are started on treatment and consistently take their treatment.
Talk to us about early, you know, mother-to-childhood transmission of HIV during the COVID-19 pandemic. How dire did this situation get? How many of these children got infected, and how many of their mothers did seek treatment?
We are looking again at the numbers. We know that, you know, there was a reduction in access to ART.
Yes.
And also, but specifically looking at the children, we had 88 in the last financial year up to June 2020.
Yes, doctor.
We had 88% of children accessing early infant diagnosis. It means within 2 months of birth, they are able to be tested. But, you know, the percentage of remaining, you know, not accessing the testing means they may be HIV positive, but their status is not known, and they are likely to deteriorate, and that may result into death. So we still have that population, but it is because somebody needs to take back these children, and that is the carer really, who is the mother or the parent of that child.
There's quite a lot we can talk about, but we are running out of time. We're also getting information that these children, actually, we do not know how many they are who have actually did get HIV as a result of giving birth. We do not have those numbers. Isn't that a recipe for disaster?
We have a fair knowledge of, you know what, first of all, the estimated total number of children living with HIV is about 98,000.
Those who got infected as a result of mother-to-child transmission.
Yeah, as a result of mother-to-child transmission. And then we track that and see, you know, how many are adhering and how they are doing in terms of, and how many are, that's how you got to get that number of how many are virally suppressed, because it's from tracking those who have been born from HIV positive mothers, have been exposed as infants. And there's a lot of work that needs to be done at the community level to ensure that, you know, communities are not stigmatizing these women. They're encouraging them. They are able to confidently go back. Their spouses, their mothers-in-law, their sisters and brothers need to support these women so that they can go to health facilities and access.
Dr. Nelson Musoba, we are talking about some 38,000 new infections, but majority of these infections, 20,000 plus, are among teenagers, 15 to 24 years of age. What is precipitating this behavior or trend?
Again, like we said, young people, first of all, do not have enough information. They don't have knowledge. They didn't see the HIV of the 80s and 90s, which was severe, which was aggressive. But also, there is transgenerational sex. We have the older men here in the 40s, where the HIV prevalence is about 14%. Indeed. Engaging into sexual activity with the young people that we've talking about. Indeed. And if it's transgenerational but also transactional, the ability to negotiate for safe sex is not there. They are vulnerable, they are still young, but also the transgenerational sex will be sex associated with violence. Indeed. If they are violated, they are 3 times more likely to be infected with HIV than, you know, non-violent sex. So a combination of those factors. Income is an issue, you know, access to the issues
sanitary
of
pads
sanitary pads, food, putting food on the table. That's what is pushing young people into becoming infected. So the interventions cannot just be information. They cannot just be availing medication and testing. It includes cushioning them against poverty and ensuring that household incomes can improve.
I see, I see. I can't let you go without talking about the drug users. Yes. The drug users have also been put out as another insignificant group that is invisible, that is also grappling with HIV infections. They are seeing the prevalence rate at around 25%. We did talk about the sex workers at 31%, those in the fishing communities at 20%. But for this group, the drug users, those who inject drugs into their bodies, are grappling with this problem at 25%. Why? What are the contributing factors?
Drug use, we are seeing this as an increasing problem, again, especially amongst young people. Indeed. You know, it is an observed trend, ranging from, you know, just alcohol use to where it gets addictive to
methamphetamine, heroin, fentanyl,
opioids, to injection.
I hear you.
Fortunately for us, again, our scientists and medical workers are doing their work. We have actually, last year we had a medically assisted therapy center opened in Butabika Hospital, and anybody who has a drug injection problem, the experts can support, because it's not easy to wean yourself off drugs once you've started. Indeed. You need help, you need health professionals, you need a lot of counseling and treatment to be able to do that. And Butabika National Referral Hospital has opened a center specifically for handling this, and they are able to do it.
Here's a $64,000 question, Dr. Nelson Musoba. Are we winning the fight against HIV? In a country where we did register 500 million cases of teenage pregnancies, 500 million plus cases of teenage pregnancies were registered in this country, meaning some of those young teenagers got infected with HIV. Yes. Are we really winning the war against HIV when we actually are dependent largely on donor funding for our HIV fight?
We can win the war on HIV. It's a very ambitious battle, and you know, looking at the time left to 2030, and the money is needed, like you've pointed out. Last year, we spent approximately $650 million on HIV, including treatment and all these other interventions we've spoken about. But about 450 million of that was from donors. I see. In fact, from the American government, we had also money from the Global Fund. The Global Fund is giving us $250 million for HIV for 3 years. Government put in some money too, I think close to 100 billion Uganda shillings for ARVs only, but also additional medication, money for supplies, about 8.5% of the total budget for HIV came from government. The target had been to increase the government funding and support to about 40%.
40%.
So in the event of withdrawal of the donor, it is easier to cover the smaller gap than the current gap.
And of course, donors are withdrawing because they are focusing on their countries, COVID-19 and so forth. And we should really talk about government funding the HIV fight. You need 28.5 trillion Uganda shillings, less of which we might be seeing an increase of HIV infections all the way from 38,000 to 140,000 by 2030.
Yeah, that is the discussion. We've done modeling and the projections of those numbers, and that the Minister of Health is aware, the Minister of Finance is being engaged, and we are saying we either pay now to avert these infections, or we will pay later when we are treating. And when we pay later when we are treating, the cost is much higher.
Dr. Nelson Musoba, aren't you worried that right now you are like that young man who has gone to a well to fetch water, but he's using a basket that has holes in it? Yes, he's laboring to fetch water, but on his way back home, by the time he reaches the his humble abode, there's no water left because there are holes in this basket.
The
basket are the teenage pregnancies. The water is your intervention as Uganda AIDS Commission.
You're right.
Aren't you worried that with these skyrocketing teenage pregnancies, we are actually just pouring water into a basket with holes? So we need to tackle that first.
Yeah, we need to close the tap.
Indeed.
Closing the tap of new infections.
Indeed.
Because otherwise it will be futile to mop the floor when the tap is still open. But there are interventions towards that, like we've spoken. There are interventions, through Ministry of Gender, through Ministry of Education. School is a powerful safe space. We've discovered that, when our children are out of school, then we can see what happened. The numbers just rose up. So once they go back to school, once household incomes improve, once they are given information, then, lots of the holes in the basket will have been closed.
Indeed.
Yeah.
Let's talk about access to treatment for our HIV patients. How has that been during the COVID-19 pandemic? Ideally, how has the COVID-19 pandemic affected the HIV fight?
The first lockdown, impacted it quite a bit.
Indeed.
There were quick lessons learned. The Minister of Health adjusted guidelines, and patients were allowed to use the nearest health center. Often because of stigma, patients travel long distances to be able to access treatment. But that was relaxed, and you could walk to any health facility. Somebody else could pick your medication for you.
Telemedicine.
Yeah. In other cases, health facilities were even sending medication to patients via other people. Volunteers, came out to go and do that. So the initial shock, yes, it impacted. We saw numbers accessing ARVs go down. We saw numbers for testing going down, but those have picked up now because of those interventions. Yeah.
And also the need for sexuality education. Shouldn't we be inculcating this into the work of the Uganda AIDS Commission, that as you go out there to front the importance of, adhering to the ARV regimen, they should also actually disseminate information on sexuality education. You do have 50% of our men and women, they do not know how to use a condom, and others do not even know how HIV is acquired.
That's powerful. That's powerful, but the first point, the most critical point on passing on correct information is with the parents.
I hear you.
So we appeal to the parents that you should be the first source of information to your child. During the formative years, as the children enter the teenage years, their bodies are changing, they are asking questions, they are seeing changes they don't understand. If you're close to your child, they will ask you the questions. If they are assaulted by somebody, they will come and tell you. If you're not close to them, they will look for this information elsewhere. And very often the information is half correct or even totally incorrect. So the home is the first place to build that foundation. Schools can add on that, and then we can use other community platforms to ensure that that is cemented.
And indeed, today is World AIDS Day. What is our take home for this year's World AIDS Day, Mr. Dr. Nelson Musoba?
The theme this year is End Stigma, End AIDS, End Pandemics. We are commemorating World AIDS Day scientifically. A small group of representatives have been invited. The national commemoration will be at Kololo Ceremonial Grounds. But we urge everyone in your setting, at the workplace, in a home, to commemorate World AIDS Day, to continue to push information out, to remember those, the warriors and champions, the fidel tires and others who succumbed to it, but to use that as a source of strength for us to continue to go out and say, AIDS is still a problem, HIV is still here, there is no cure, There is treatment, but we need to continue fighting.
Very powerful conversation with the Director General for the Uganda AIDS Commission, Dr. Nelson Musaba. Thank you very much for having made the time to speak to the citizenry on this very auspicious World AIDS Day. They needed to hear the information that we've divulged today. Thank you very much again.
It's a pleasure. Thank you.
And indeed, all over the world, 43.2 million infections have been registered this year alone, 2021, and over 1.5 million people have died as a result of this HIV epidemic. And it's also going to become a pandemic if stigmatization and discrimination against patients actually does continue. Please do not stop adhering